This video is one tool designed to help you and your healthcare provider determine whether Implanon is right for you. Be sure to review the patient brochure, patient labeling, and the consent form. Your healthcare provider will review the consent form with you to be sure you understand the potential risks and benefits of using Implanon. And remember, because Implanon is discreet after it is inserted, be sure to tell all of your healthcare providers that you are using it. Don't forget that your annual physical exam with your healthcare provider is still important while you are using Implanon. You can ask your healthcare provider for additional counseling material or visit www.implanon-usa.com for more information. The evolution of contraceptive options over the years has produced some revolutionary breakthroughs. From new delivery methods designed to make contraception more hassle-free to options that offer effectiveness over a longer period of time, the changes have been substantial. Introducing another step in the evolution of contraception, Implanon, the single-rod implant contraceptive. Implanon is a discreet and effective method of contraception. Since 1998, approximately 2.5 million Implanon units have been prescribed in over 30 countries. It's effective contraception that doesn't require daily, weekly, or monthly administration. The contraceptive effect of Implanon lasts up to 3 years, but it can be removed at any time. Implanon is a small, thin, implantable contraceptive that is put under the skin of your arm in an in-office procedure. It offers you a method of birth control that is effective for up to 3 years. Implanon, it's effective contraception that doesn't require daily, weekly, or monthly dosing. You're looking for a method of contraception. Perhaps it's the first method you'll use, or maybe you're looking for something that does not require daily, weekly, or monthly dosing. You may have a month-old baby and are breastfeeding. Maybe your life is just too hectic to be worried about remembering to take a pill every day or worrying about a patch every week. Perhaps you're tired of making time to see your healthcare provider for a shot. Or maybe you're done having children, but are concerned that sterilization is just too final. Whatever your situation, if you're looking for contraception that lasts for up to 3 years, Implanon may be an option.
Hi, Kimmy.
Hi.
Come on in, have a seat. I understand you have some questions for me.
Yes, I do. So what exactly is Implanon?
Well, Implanon is a contraceptive implant containing the progestin etanogestrel. It's made of a small, thin, flexible medical material, and it's less than 2 inches long. Upon insertion, it continuously releases a low, steady dose of a non-estrogen hormone. This is what it feels like. Also, keep in mind, though, Implanon does not protect against sexually transmitted diseases, HIV, or AIDS.
How will Implanon affect my periods?
There are some side effects associated with using Implanon that you may expect. The most common is irregular bleeding, just like any other progestin-only method. You can expect your menstrual period to be irregular and unpredictable throughout the time you're using Implanon. You may have more bleeding, less bleeding, or no bleeding at all. It is normal for your bleeding to continue to change over time, and the amount and duration of bleeding will vary from woman to woman. You may find that the total number of bleeding days with Implanon is not much different than what you experienced without contraception. I'm going to give you the Implanon personal calendar so you can track your bleeding discreetly and conveniently. I recommend you complete the personal calendar and bring it back with you on your next visit so we can talk about it. We should always discuss any questions you have, and you should be sure to let me know if your bleeding is heavy, prolonged, or if you think you may be pregnant.
What are the side effects that cause women to stop using Implanon?
In clinical trials, the most frequent side effects that caused women to discontinue using Implanon were mood swings, weight gain, headaches, acne, and depression. You can find more information on all these side effects in the patient labeling, which I'll provide to you.
So how is Implanon inserted?
Implanon is inserted just beneath the skin of the inner side of your upper arm. Insertion is done with a specially designed applicator. The entire procedure will be done here in the office, and it's done using local anesthetic, and it generally takes only a few minutes.
Will I feel the rod being inserted?
Some women may feel a slight pinch when Implanon is inserted, similar to a shot, but a local anesthetic is used to minimize the discomfort. It's possible that you may feel some mild soreness or tenderness at the insertion site for a short time after the procedure.
When is it recommended that I have Implanon inserted?
Normally, it's inserted between day 1 and 5 of a woman's menstrual period if she's not currently using hormonal contraception.
When I started my previous contraceptive, I had to use a backup method in the beginning. Will I have to use a backup contraceptive with Implanon?
A backup contraceptive is not necessary if Implanon is inserted as recommended.
I read in the patient brochure that I should discuss any other medications that I am taking.
Actually, yes, it's very important to discuss any other medications you might be taking, including prescription medicines, over-the-counter medicines, herbal remedies, or supplements such as St. John's wort. You should make sure to call me if the medications or supplements you're taking change. There may be interactions with some of these medications that could decrease the effectiveness of Implanon. If so, you might need to use a backup contraceptive.
Will the insertion or removal of Implanon leave a scar?
No incision is required to insert Implanon, and only a very small incision should be necessary for removal. As with any procedure like this, there is a small risk of a scar. If you're prone to scars or keloids, we should discuss this further.
Will anyone be able to see it once it's inserted?
Most women can't see Implanon after insertion.
Do I need to limit my physical activity to prevent it from moving in my arm?
You should not be aware of Implanon in your arm during everyday tasks. Exercise and physical activity should not affect Implanon.
Is it okay to leave Implanon in my arm for 3 years?
Implanon is made of a medical material that is specifically designed to stay in the body for long periods of time. Implanon does not contain latex or silicone, and Implanon will not dissolve.
What do I have to do when it's time to have it removed?
The contraceptive effect of Implanon lasts up to 3 years, but it can be removed at any time. When Implanon is inserted, you'll receive a user card that lists the removal date. You would keep this card at home with your other important health records. You must schedule an appointment for removal on or before the expected 3-year removal date listed on the card. Now, if in the event that you're seen by another healthcare provider, you should tell them you're using Implanon. Removal should not be attempted unless it's been located by palpation or touch or ultrasound. In clinical studies, fewer than 2% of patients experienced complications with removal of Implanon, such as pain, bruising, or difficulty with locating the implant.
So how is Implanon removed?
Implanon can be removed during an office visit. The procedure should take only a few minutes. It involves making a small incision in your arm and removing the Implanon rod. Because a local anesthetic is used, you should feel little or no discomfort during the procedure. Some minor bruising, redness, swelling, or pain may occur where Implanon was removed. In less than 1% of the time, the implant cannot be removed on the first attempt, so additional procedures may be necessary. After Implanon is removed, it is possible that your fertility will return quickly, so if you don't want to become pregnant after removal, you should have another Implanon inserted or start another birth control method right away.
What do I do if I want to continue using Implanon?
A new Implanon can be inserted in the same arm and often in the same place where the previous one was, or it can be inserted in the other arm. Do you have any other questions?
No, you've answered everything very well. Thank you so much.
You're welcome.
This video does not take the place of speaking with your healthcare provider and thoroughly reading the enclosed patient labeling and consent form. In addition, talk to your healthcare provider about using Implanon if you have or had diabetes, high cholesterol or triglycerides, headaches, seizures or epilepsy, gallbladder or kidney disease, depression, high blood pressure, allergic reaction to anesthetics or antiseptics.